Hi, I'm Vicki Liviakis. Welcome to Body Beautiful. This is a show where we talk with local professionals about the latest in cosmetic procedures and medical advances. Plus, we take your calls live on the air. With us today, we have plastic surgeon Dr. Elizabeth Lee from Berkeley. She is followed by Seema Hildy, a hair restoration specialist from the New Look Institute. And later, we'll be taking your phone calls, I promise, answering any questions you might have. The phone number, 800-440-4884. We'll also be posting the phone numbers to the guest offices, so be ready to jot those down. And before we get started, any advice we give you today, obviously you're going to want to consult with your own physician for a second opinion. Always good advice. Welcome back to the program, Dr. Lee.
Thank you.
Last time we had you here, we were talking about lips.
Yes.
And you have a fabulous pair of lips, and we're not going to talk about lips today because we're moving on to a different body part. We're talking about the stomach. And, you know, everybody, you see all the infomercials on the six-pack abs, and I mean, is this something that all of us can do? You can just go to the gym and automatically...
Well, you know, the way your stomach looks depends a lot on how you were born, on how your muscles work. But one thing that's important to understand is that after you have had a pregnancy, things stretch out. And not everybody stretches to the same point as other people, and some people's tissue has more elasticity than others, but very often you're left with what we unkindly call a deformity after delivering. That is something that can't be corrected no matter how much you go to the gym. You know,
it does, my mom friends, you know, after we had our children, I mean, everybody kind of, you bounce back. I mean, the body is sort of made to do that, but the bounce back varies.
Exactly. And so what can happen is that you can be left with a separation of the midline muscles, which are called the rectus abdominis muscles. And when those muscles don't come back to the midline and touch each other again, it's because the connective tissue between them has stretched, and that connective tissue has no elasticity, so it can't rebound. And so those muscles are not in the correct position. All the rest of your abdominal wall muscles follow with them, and so you lose core stability. So it really is a functional issue as well as a visual one.
Okay, I know people are going to want to know, you know, after the Hollywood stars have their children, and it seems like, boy, it's been epidemic out there, everybody's having a baby. They look fantastic. I mean, it just seems like 1 week after giving birth, they're already in a slinky gown. And
well, some of them are, and some of them are not. And I do remember seeing that Jessica, I'm slipping on the name. Sorry. Yeah. Anyway, she is an actress who was on the cover of Vanity Fair about 4 weeks after delivering her son, and she was on the cover with her abs sculpted and everything. And she said in the article, you know, I'm very uncomfortable doing this talk or doing this interview because I don't want women out there to expect to look like this. This is my job to look this way, and I have a trainer working with me 8 hours a day, and I don't eat anything that is not put in front of me by my dietitian, and most humans aren't able to do that.
Okay, can we also add that they airbrush and they alter the photographs?
Very often they do, but
we can't do that in real life.
No, we can't do that in real life. We have to walk around with what we have. So if you have a separation of those muscles and you have an abdominoplasty or a tummy tuck procedure, what we're doing is putting those muscles back where they should be, so that when you do have the time to exercise and train, you're doing it much more efficiently because those muscles are working properly.
Okay, so that is really what we're talking about here, tummy tucks.
Exactly.
What can a tummy tuck do, and we're going to need to go to a break here, but really quickly do that, you know, a month at the gym and a personal trainer can't do?
Well, what a tummy tuck does is pull those muscles and anchor them back in the midline so that you can do all sorts of Pilates and things like that. You can actively learn to bring your muscles back into the midline, but as soon as you relax, they go back out to the side. And so you can't maintain that without actively doing it.
So you're saying that really this is the only way. If you've... All right, we were to... Obviously, we've opened up a can of worms here.
That's
we
right.
need to talk about this. We need to take a quick break, but...